Guys, what is anxiety, right? So anxiety is a natural and adaptive response to stress or perceived threats, right? It's a normal part of the human experience and can serve as a protective mechanism, preparing the body to respond to danger, right? So however, when anxiety becomes excessive, prolonged, or interferes with your daily life, it may indicate an anxiety disorder altogether, right? So now let's just focus on the key features of anxiety. So the first one is emotional component. So what is it all about? So basically it's about anxiety often involves feelings of uneasiness, fear, or worry. Individuals with anxiety may experience a sense of impending doom or dread without a specific cause, right? So that's about it. Now let's go to the second part, which is physical symptoms. What does it mean? So anxiety can manifest with various physical symptoms, including increased heart rate, muscle tension, sweating, trembling, dizziness, or gastrointestinal discomfort as well. Guys, let's talk about the cognitive aspects, right? So individuals face anxiety that they have difficulty in concentrating or excessive worry about future events and things like that, right? They may also experience intrusive thoughts or irrational fears as well, right? So that's about it. Now we'll just talk about behavioral changes. Here, anxiety can lead to behavioral changes such as avoidance of certain situations or activities that are perceived as threatening, right? Individuals may also engage in rituals or repetitive behaviors as a way to cope up with anxiety. Now, let's move to the types of anxiety, or let's say types of anxiety disorders altogether. So, the first one is generalized anxiety disorder, which is also called as GAD. It means it involves excessive, persistent worry about everyday events or activities, often with no apparent cause, right? The second one is panic disorder. What does it mean? It is characterized by sudden and intense episodes of fear known as panic attacks, accompanied by physical symptoms like chest pain. There could be shortness of breath and a sense of impending doom as well, right? Now let's move to the next one, which is social anxiety disorder. What does it mean? It involves an intense fear of social situations and fear of being judged or embarrassed in public. Right, so that's about it. There are specific phobias as well, which involves an intense fear of a specific object or situation, leading to avoidance kind of behavior, right? Now there is also obsessive compulsive disorder, which is also called as OCD. It involves intrusive unwanted thoughts, which you can call as obsessions, and repetitive behaviors or mental acts, which you can call as like compulsions. They are aimed at reducing anxiety. Then you have post-traumatic stress disorder, which is also called as PTSD. It develops after exposure to traumatic event and involves symptoms such as flashbacks, nightmares, and heightened arousal altogether. Right? Then you have separation anxiety disorder, which talks about often seen in children and involves excessive anxiety related to separation from attachment figures, leading to fear and avoidance of being alone altogether, right? So then you have selective mutism also. It is primarily observed in children. It involves consistent inability to speak in specific social situations despite speaking in other situations, right? So that now let's go to causes of anxiety. So the first one is biological factors. It involves like genetics, brain chemistry, and imbalances in neurotransmitters can contribute to anxiety. Right now, there could be environmental factors as well, which is like stressful life events. There could be trauma or chronic stress, things like can actually trigger or basically they can exacerbate anxiety altogether. There can be personality factors such as personality traits wherein perfectionism or let's say a tendency to be overly cautious may contribute to anxiety as well, right? There could be medical conditions wherein underlying medical conditions such as thyroid disorders or cardiovascular issues as well. They can sometimes manifest with symptoms of anxiety, right? So that's there. And then probably substance abuse as well, wherein the use of certain substances which include caffeine, alcohol, illicit drugs can contribute or it can exacerbate anxiety altogether. So now let's talk about treatment, right? So in treatment, basically treatment for anxiety may include a combination of psychotherapy, medication, lifestyle changes, and support from loved ones. So, cognitive behavioral therapy, which is also called as CBT, is commonly used therapeutic approach for managing anxiety. So, there are medications such as selective serotonin reuptake inhibitors, which is also called as SSRIs. They may be prescribed in certain cases as well. So, yeah, that's about it. So, basically, if you suspect you or someone you know is experiencing anxiety that interferes with daily functioning, seeking the guidance of a mental health professional is actually recommended, guys. So they can actually provide an accurate diagnosis and develop a tailored treatment plan as well to address the specific challenges which you guys might be facing, which are associated with anxiety. So that's about it in today's video. Thank you so much for being here.